completely and utterly fine. I'm fine. I am fine. I'll be fine. I am completely and utterly fine. I'm fine. I am fine. I'm fine. I'm always fine, don't you?
As a licensed psychologist, I tend to roll my eyes internally when my clients tell me about what they saw on TikTok. I saw this video on TikTok. It goes on to describe things that aren't accurate and have nothing to do with them. I have been wanting to talk about this for a while on my channel. I came across this really long article that I think can help me share some views on my concerns for not just TikTok, but social media in general and how they are framing mental health. It says a growing cadre of psychiatrists and mental health professionals are concerned that spreading mental health awareness via TikTok is counterproductive and potentially even harmful. Adding urgency to their worries, 2/3 of US teens have used TikTok, and 1/6 say they use the app almost constantly because TikTok is extremely addictive. I tell people I don't use TikTok. As a content creator, I upload things, but at most I might look at 3 or 4 or 5 videos on TikTok before I get off the app because it is so incredibly addicting. It really, really is, from it taking up your whole screen so that when you move from one video to another, you don't see borders, to the algorithm being extremely curated to your interests, to the catchy, the people who do well, them sharing. It's just a lot of reasons why TikTok is addictive. And so I don't use it. I don't think it's good for anyone's mental health to spend more than 10, 30 max minutes on TikTok a day. I really don't. More over 40% of adolescents are now initiating internet searches on TikTok instead of Google, which is wild to me because most of TikTok is just personal anecdotal storytelling. I really would encourage people to search multiple sources. An area of mental health that gets frequent attention on TikTok is anxiety. I would also say autism, ADHD, which I think I perused this article, they talk about a little bit later, also get talked about. That people pick out one symptom and they're like, oh, I think I'm autistic. I get that often. Oh, I think I'm autistic. Oh, I think I have ADHD. They have neither. They're nowhere near a person on the spectrum or with a neuro developmental disorder, but they saw a video on TikTok. Videos frequently portrayed as a debilitating disorder, but the fact is that everyone at one time or another experiences it. True. There's no line in the sand between the people who experience normal anxiety and those who experience clinical anxiety, right? It differs per person. It's a gradually changing spectrum with 1,000 shades of gray. But this point gets lost in the public conversation, says Dr. Lucy Folks. Campaigns and social media posts just turn out the message that there's this problematic thing called anxiety. And so people start interpreting all the lower level stuff as symptomatic of a disorder, calling this prevalence inflation. Anxiety isn't the only mental health issue that TikTokers showcase. Autism, attention deficit hyperactivity disorder, borderline personality disorder, which is so true, and obsessive compulsive disorder. They could add in narcissistic personality disorder because that's a very popular one. And like with anxiety, many content creators encourage viewers to self-diagnose, which is highly problematic. I did a post about Amanda Seals and her self-diagnosis. I directed followers to an article that will give you some more information about when self-diagnosis might be helpful, when it might not. It's very much case by case and dependent on your symptoms and your environment. According to surveys, Generation Z, born between 1997 and 2012, is especially likely to self-diagnose mental health disorders, with one survey suggesting 3 out of 10 members of the cohort have diagnosed their own mental health issue. Dr. Folks, is one of the most outspoken academics arguing that mental health awareness has gone too far. That's an interesting wording. In a recent New York Times article, she pointed out that targeted interventions in schools have either been ineffective or actually worsened students' mental health. Some students began over-interpreting their symptoms, perceiving them as signs of mental illness. Others spent more time ruminating on their thoughts and feelings at the expense of their overall happiness. While there's less research focusing on the effects of TikTok's mental health awareness videos, it's reasonable to assume they could be worse than in-person interventions. One reason is oversimplification. How long is an average TikTok video? 10 seconds? Maybe 30 seconds. I know you can do up to 10 minutes on the app, but most people are not doing 10-minute videos on TikTok. They're like this. In a 2022 study, researchers analyzed 100 videos that were displayed with the hashtag mental health. Each averaged 13.4 million views. They found that almost half simply reported or expressed symptoms of mental distress, like the crying woman. Moreover, the vast majority were not posted by healthcare professionals, right? Because capitalism. The study reinforces a fact of TikTok's almost mythical algorithm. Their algorithm really is good. It shows what gets your attention, not necessarily what is nuanced, truthful, or helpful. Therapy influencers flood social media feeds with content about trauma, panic attacks, and personality disorders, Dr. Folks writes. When teenagers gravitate towards such content on their social media feeds, algorithms serve them more of it, intensifying the feedback loop. This is unrelated, but this reminds me of a whole separate video I need to do on sex trafficking and how rare and unlikely it is, improbable it is for a stranger to self-traffic you, an adult or a child, and how much more likely it is for that child to be sex trafficked by a family friend or a family member, or from somebody that they met online who they gave their address to and then came to pick them up, whether from school, whether from the street, whether from home. Don't get me started. Okay. Self-diagnosis and social contagion. A study published earlier this year aligns with Dr. Folks' claims. I don't like that they don't put doctor in front of her name. Researchers, because this is about research. Researchers from the University of Delaware analyzed 100 TikToks with at least 1 million views focusing on depression, anxiety, or both. They found that videos featuring personal experiences had higher engagement than videos produced by health professionals. Well, that makes so much sense because people like chaos. Most people like chaos. The average person likes chaos. These personal experiences included descriptions or emotional displays of depression and anxiety symptoms. The attribution of generic symptoms to these mental health conditions may result in self-diagnosis. This self-diagnosis can even take the form of a social contagion. A few years ago, clinicians noticed a jump in young people expressing odd tics. A tic is like a body movement that is involuntary. Many of these young people thought they had Tourette's syndrome. As it turned out, they had been frequent watchers of a popular YouTuber who talks about the condition. After professionals told them they didn't have Tourette's, the symptoms disappeared. There's a whole other diagnosis in our DSM where people create disorders, create symptoms of a disorder that they're so sure they have because they believe it. There's another word, another word for that. They don't think they have that they're, faking or making themselves sick. They just really believe something is wrong with them. To TikTok's credit, the company offers a brief but thoughtful guide on posting videos related to mental health. It encourages people to share stories of coping, hope, and recovery, as these can be helpful, and to avoid topics that can be triggering to others. However, most TikTok users are likely unaware of this research. Many of these TikToks are taking human emotions and experiences and trying to categorize them into these neat boxes of a diagnosis, she said. This can lead viewers to misunderstand something that a trained mental health professional who has also collected additional information on that person's symptoms, functioning history can interpret. I didn't go to school for all these years for nothing, okay? I've read the research. I've worked with the people, thousands of people at this point. Without that education, research, experience, like the self-diagnosis, the social media of it all is just wild. It's like the wild, wild west. Hemdinger was alluding to the risk of wrongly interpreting normal human experiences as disorder, termed pathologization. Pathologization. You can't just throw a diagnosis label on something all the time, she said. A term she often notices on TikTok is high functioning. People claim to have anxiety or depression, but also say they are high functioning, but it's not a clinical term. If you say you're high functioning, then you don't technically have an anxiety or depressive disorder. I had used the word high functioning with my healer when I was describing Chesley, who jumped off of the building, the Miss USA. High function is not the right word. It really is not the right word, because just because someone appears to be functioning does not mean they are actually emotionally well. And so I feel like masking might be a better word for describing somebody who presents okay on the surface, but really on the inside is going through a lot of turmoil. But is young people's tendency to label themselves as anxious or depressed necessarily problematic? A great question. Or are some psychiatrists overreacting to what they perceive as a hijacking of terms? Joseph Davis said, when I asked the people I interviewed if they thought they were suffering from a mental illness, virtually all said no. We've medicalized emotional distress by putting it into flat, homogeneous categories like depression and anxiety, but people have really picked up on that. The clinical terms are replacing our emotion words as well as other ways of talking about difference. Words matter. Language is important. The way you decide to communicate, I think, is sort of vital to getting your point across, being perceived as you are expressing yourself. And so that we all know we're talking about the same thing, right? Words matter. I see a lot of problems with the vocabulary of diagnostic psychiatry being taken up by lay people. Same. While providing a congenial community can certainly be helpful, my general impression is that the interpretation of everyday struggles on this site is typically in narrow and often biological terms rather than in any broader moral or existential register. I worry that the personal support comes at the cost of adopting an unhelpful perspective. Another potential problem with the deluge of mental health awareness videos on TikTok is that it drives up demand for therapy when there's already a serious shortage of licensed mental health professionals in the United States and the UK. To be clear, some of this added demand is coming from individuals who absolutely need help, but a good chunk may be from people who watched videos on TikTok and began pathologizing everyday emotions. I think there's still benefit in talking to a professional if you are one of those people to pathologize your basic emotions just for the education. You might take up a couple sessions but not be seen on a long term. A cynically minded individual might think that mental health professionals would welcome all the extra work that results when people turn everyday emotions into mental health problems. Who is this? Simon Wesley says, we are not part of the global conspiracy of making everyone into a mental health problem. I completely agree. We do the opposite. We will say, look, this isn't a psychiatric problem because we are acutely aware of the dangers of over-medicalization of what are normal emotional problems. Other health professionals welcome the attention mental health receives on platforms like TikTok and think worries of overdoing mental health awareness are misguided. Dr. Hamdani says, many of my patients have first considered a diagnosis because I saw it on TikTok and now are able to open up a dialogue about the condition more freely. I think this is more so how I feel about it. However, she admitted that the platform features a lot of misinformation, which is my concern. My patients would hold up their devices to the screen and show me the latest TikTok tidbit about mental health. A lot of it would be regarding potential self-diagnosis, and a lot of it was absolutely garbage. Let me read that again, because that is literally how I feel. A lot of it would be regarding potential self-diagnosis, and a lot of it was absolute garbage. If you are wanting to diagnose yourself, I want to say don't. See a psychiatrist, see a psychologist, please. Yeah. Dr. Hamdani joined TikTok to fix the problem, and now she has over 9,000 followers. I like that. There also is a case to be made that any benefit of mental health awareness videos on TikTok doesn't arise from the videos themselves, but rather from the supportive community that springs up around them. The supportive community. Gallagher says that she analyzed the comments on randomly selected videos about mental illness and she found that 95% were positive. Commenters share their own experiences, praised the content creator, offered strategies, and posted arguments. I would say probably a lot of social media comment sections that aren't like the mass, like when I think of the Shade Room. I don't know if the Shade Room has 95% positive reviews, but they have really low vibrational content. The proliferation of the mental illness community on TikTok allows users to feel empowered by sharing their stories and starting dialogues to raise awareness and celebrate one another's victories, which is what I said about Amanda Seales. I hope she gets the community she's looking for from the autism community. I don't think she will because she's not autistic, but I hope that sharing her story, people are rallying around her and really supporting her in this experience so that she can really feel like she relates to people. TikTok and other social media sites are going to see mental health content online no matter what. That means that mental health professionals need to get involved to improve it. Hey, this is why I exist, okay? As clinicians, we should be proactive in adopting new technologies, not reactive. As part of being proactive, clinicians should form groups to work with companies to improve standards. 2 things that TikTok can do better include warnings on misleading content and inform viewers where and how to obtain mental health services. I feel like they should also push people who are saying the truth, right? Research-based information. He also said that mental health professionals should join social media and create their own content. Hey, that's what I'm doing. We as clinicians should be ensuring access to reliable content, not simply criticizing the various media patients use. I completely agree. At the very least, having these my clients come to me with, I saw this on TikTok and do you think I have, it brings a conversation that wouldn't have been had if they had never seen the video, and gives them some information from a reputable source, me, that they can then go on to share with other people. I am concerned with the way social media is. I am concerned specifically things like TikTok and Instagram, not just how they're framing mental health, but how they affect people's mental health. And this is 2024, the age that we live in, where so much of how we do things is internet based. I'm a little concerned. But I do feel like I'm part of the solution, part of what's helping to balance things out online. Let me know what you think in the comments. Please give this video a like if you enjoyed it. Subscribe to my channel for more videos like this. Share this video with somebody you think it may help, who's always on TikTok probably. And thank you for watching.